everybody, and welcome to Conversations in Aesthetics. I'm your host, Gary Goldenberg, dermatologist in New York City. Today, I'm so happy to introduce our guest, Dr. Mark Nestor, who is in South Florida. Mark is a great dermatologist, both medical and cosmetic, a businessman, an entrepreneur, a researcher. Really, Mark, you're a Renaissance man. For as long as I've known you, you've really been a Renaissance man. I'm so happy for you to be here, and thank you so much.
Gary, it's my pleasure to be here. I'm excited to do this with you. So, this is really what dermatology is all about. It's talking about what's important, talking about what I believe is the future, which is health, happiness, and well-being for our patients.
Well, all of us should be happy and be well and look great. So for the few people that may not know all of your history, why don't you take a minute or so and just introduce yourself? Tell us a little bit about yourself, sort of your career path, what you like, what you don't like, etc.
Wow, sounds great. I am a dermatologist. I went to medical school at UCLA a long time ago. I got my PhD in immunology as well. I did my residency in New York at New York University. And I've been in practice for over 34 years. I tend to do a lot of clinical research for the last 30 plus years. I also have built a number of different things, practices that we have sold and merged. I started something called South Beach Symposium about 26, 27 years ago.
It was a great meeting.
It was a good meeting, and that was sold. I consult with a lot of companies worldwide on new products and new innovations. And at this point, as you know, and you're the same way, it's really about, what's best for our patients and really innovating in terms of what's best for our patients and enjoying the practice of dermatology.
That's great, Mark. And I would be remiss to say that it's a real pleasure to work with you with Derm Squared and being co-directors of all the meetings, et cetera.
Mm-hmm.
And it's been really a great experience working together. So we're gonna dive right in, okay?
Absolutely.
Patient comes in, they're being sent to you by a friend or a family member or another dermatologist. They looked you up on Google or ChatGPT, send them to see you. You walk in, and give us sort of an understanding of what your cosmetic consultation is like. Sort of what are the boxes you check? What do you talk about? And what's the art of that consultation?
So, first of all, I want to know what the patient is concerned about. I think a lot of this boils down to the patient's needs and wants. My way of looking at it is, first of all, I look at the patient holistically. I want to listen to them. It doesn't mean I'm going to do what they want because, again, I want to give them the best treatment. And sometimes that best treatment is, what you want is not what I would choose to give. I think you should go elsewhere. That's possible in terms of treatment. It doesn't happen a lot, but it certainly can happen. The idea is to assess really the patient's wants and needs. And some of it, as you know, really comes out of left field. Some of it is, I have this one line that my mother or my grandmother had that it's really driving me crazy, even though I don't even see it. Or, I had acne when I was a child and now I'm upset because I have some scarring, or as something you see on a daily basis, and I do as well, I'm losing my hair. I need some help in this regard. So the idea is to listen. The idea is to gauge and then use what I would call science-based knowledge, which we have, thank goodness, for a lot of what we do, both clinically and aesthetically, to say, okay, I can help you by offering you X, Y, and Z. And I'm lucky that I have over 50 devices in my office, so I have a plethora of different options and opportunities for my patients to be treated with devices. Also, as you do, I can inject fillers, toxins, collagen stimulators, etc., as well to do it. My whole purpose is to make sure that the patient looks better, hopefully is happier and has a sense of well-being, but is in doing this in a normal way. I want patients to look healthy and happy, not to look done, not to look overdone, especially. So I'm a minimalist in certain ways. I tell my patients, let's start with this. We can always add more. And I think that that approach has served me very, very well, as well as my patients.
There are a couple pearls in there, Mark, that I want to just tease out a little bit. And the first one that you mentioned, and I totally agree with you 100%, is that it's okay to turn patients down or turn them away because not every patient is the right patient for you, and not every doctor is the right patient, the right doctor for the patient. So I think, I'm with you in the sort of less is more. And I always tell patients, my job is not to make you look younger. It's for me to make you look the best you can at your age. And
Mhm.
I think something else you said, something I hear all the time. Nobody wants to look like one of those men or women, overdone. And I know where you are, you guys, South Florida, you push the envelope a little bit more than we do in New York City. Here, people really want less. It's like that quiet luxury thing. But
Right.
I totally agree with you. I think saying no or saying, look, I may not be the right person for you, maybe go see someone else, get another opinion. I think that's just so critical in having not only a happy patient, but also you have to be fulfilled in what you're doing day in and day out.
Absolutely. And they have to have realistic goals. I think that's part of it. You can, I have, and you have patients come in all the time with pictures of when they were, 20 years old and, they're 70 now and they're saying, I want to look like
With
this.
one
And
syringe of filler.
exactly one syringe. Or no, I think Botox can do that. That's a classic thing. I've
For
read that
sure.
Botox can do this. And I say, yeah, okay, yeah, I will try to make it look better, but I cannot do this. And part of our job is to educate patients. Let's be very clear. The educational process is both, what are the risks and benefits, certainly for the procedures that we're doing, but it's also to rein them in terms of realism, to say and to document that, I can do this, but I can't do that. I don't think it's realistic to think that all your wrinkles are going to be gone. Yes, we can make them better. I can laser you. I could do this, etc., and it can improve it, but it's not going to be gone. And things are not going to last forever. And the most important thing I tell them is the aging process will continue. So no matter what they do, and I tell them if you get a facelift, if you get laser resurfacing, no matter what it is, it's not going to stop the aging process. And so, there is going to be a time where you're going to feel like you might need to do something else, and that's okay.
And these are not permanent solutions. I have that conversation with patients all the time. Whether it's something that I'm doing or I'm sending it to my friends who are doing plastic surgery, if you get a facelift or you do a laser, it's not permanent.
Mm-hmm.
There's going to be another time where you're going to need another procedure. It's not because they don't work. It's because the aging process is continuing.
And that's it. And it's funny. I actually tell them some of the stuff I do is permanent. However, the aging process is going to usurp that. It's not like if I do laser and the wrinkle's gone, that's not a treatment that's going to last. Of course it is. But when you go in the sun or when you have facial movement, etc., you're going to get new wrinkles. And the wrinkles may be in the same spot, and that's okay. It's funny. I saw a patient a couple of weeks ago who I did a laser on 20 years ago. It was a CO2 laser, it was a deep laser. And she looked better than when she did 20 years ago. It was amazing how well, old style, and this is really where we're coming back to some of this thing, especially resurfacing, how long the benefits last from this. But she came in and she said, look, I have these wrinkles. And I said, yeah, it's been 20 years. What do you know? You look great, for the age you are right now. And so again, realism is such an important educational thing that we have to do with our patients.
I have to agree with you. I love CO2. I think if I can get all my patients to do CO2 resurfacing, I think it'd be a lot better. And let's be realistic. And I tell patients this all the time. A lot of the effects of the facelift are actually from the CO2 laser,
Mm-hmm.
from skin tightening, from collagen stimulation. Sure, you got to have somebody who knows how to pull in the right directions and create those right vectors. But I think CO2 is just such a great treatment and so
Yeah.
underutilized because of the
Absolutely.
downtime.
Yeah, no, I agree. And, I use a lot of long pulse erbium. I certainly use fractional CO2. I have all these different tools, and we can choose the tools based on the patient's needs from that perspective. And you're absolutely right. I think that if patients are willing to have the downtime, they get much, much better results, from these more ablative, as we call them, procedures. They get better results, period. But they have to be willing to have the downtime. And in today's modern age, it's interesting. People want immediate results. They don't want any downtime, and they want absolute, 100% benefit. And again, our
And it has to
education.
be free.
Oh, of
Don't
course.
don't
Yeah,
forget it has to cost very
or
little.
at least inexpensive. They have that
That's right.
Groupon.
That's right. Well, I think that it's probably all of our colleagues, not only in dermatology, but anyone practicing aesthetics is kind of feeling that, plastic surgery, oculoplastics, et cetera. So one more thing I know we're going to talk about regenerative medicine, and I love that field and I know you do too, but you mentioned something about hair loss, which I've just seen the number of those patients just go up, 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 up in the past 5 years or so. And I'm probably seeing now more women than I'm seeing men.
Mhm.
It's really, I feel like it's an epidemic, and I'm seeing the pattern of hair loss in women. It's not what I learned in residency, 20 years ago. They're really getting recession, bitemporal recession and thinning. What are you seeing in your practice as hair loss? I don't know if it's a New York thing, or are you seeing that same kind of thing
No,
in
I
South
think I
Florida?
think there's no question. There's two things that are happening. Number one, women especially are more educated as to, wait a second, I didn't realize not only is it a thing, but I can do something about it. I think that's one of the things that's changed in the last 5 years, especially, is that individuals, especially women, know that they have options that they may, in the past it's been, okay, my mother's hair was losing, I'm going to lose my hair. It's going to gradually go down. Eventually I'll get a wig, etc. And I think that over the last 5 years, there's been so much social media and other education that, hey, you can do things about this. There are medications you can take that work. There are topicals, there's injectables, a whole plethora. There's light.
Regeneration. It's true regeneration.
Yes, absolutely. So I think that that's important. Now, is there more of it? Good question. I think that, there's a lot going on that's happened since the pandemic. And we see this, and I talk about this in my lectures a lot, even with botulinum toxin. Botulinum toxin, we're seeing more and more individuals that have resistance. You need more to get the same effect, or you're not getting the effect.
100%. I see that
And
every day
and
in
I
my
think
office.
part of this stemmed. There was an Israeli study that showed that some of this stemmed from the pandemic. Whether it was the actual COVID infection, which I believe it was. Some people feel it was the issue of the vaccine. I think it's more of the COVID virus was really strange in terms of how it upped the immune system in certain ways. We have a lot more
Highly
autoimmune, whether
antigenic.
it's thyroid. There's a lot more, thyroid disease and other things, and a lot of what you're talking about, especially hair, frontal fibrosing alopecia. I see so much more than I ever have in the past, and that's more of an autoimmune phenomenon that we know. And this seems to have gotten much more significant after the pandemic.
Yeah, I agree 100%. And I don't think we're ever going to know if it's the actual virus or the vaccine. And I don't think it makes any difference, to be quite honest. But I definitely think that we are seeing more. And I think frontal fibrosing is something that's probably being misdiagnosed a lot of times, because I think it
Mm-hmm.
takes real experience to see it. And what I'm seeing more and more is I'm seeing more sort of bitemporal recession. And if I am adding a corticosteroid injection to, let's say, PRP or exosomes treatment, those patients are improving. I do believe there's an inflammatory
Yeah.
component to that hair loss, which I think leads us into, I know what you're excited about, talking about regenerative medicine, because part of regeneration is really having an anti-inflammatory effect, whether it's PRP, whether it's stem cells, whether it's exosomes, whether it's NAD, whether it's medical foods. So I want to kind of focus on that for a little while, Mark.
Absolutely.
Why don't you tell the viewers and listeners sort of the things that you are most excited about when it comes to regeneration?
So I think that there's been a very positive focus on health and well-being that's occurred, especially over the last 10 years. I think people are looking for two things. They're looking for natural, but they're looking for natural connected with science. Okay. Unfortunately, in the last few months, year, etc., that's gotten a little cloudy because the science has been taken a lot away, and it's more about issues of social media, etc. But I think that in really the best terms, the idea is to marry what is age old science in a way, okay, but natural science with new scientific studies that show things are effective. And the corollary to that also, the way I look at it, is that it's got to be something that we can reproduce and know what we're taking. And this is very important because I think that for a lot of what we look for health, okay, we go into the health food store, we look at supplements, we have no clue what's in that supplement. We have absolutely no clue. It may vary from month to month, year to year, brand to brand. Even if it's a very positive ingredient, we don't know if it's absorbable. We don't know what the story is. And I think one of the things we know about medicine is that the studies are always done to make sure that if you take this much, you're going to get this result, number one. But number two, that month to month or bottle to bottle, pharma guidelines, the pharmacy is making sure, the FDA is making sure that you're getting things consistent from month to month to month. And that's critical because I don't want to go into a health food store and find something that, hey, I want to do this, and then all of a sudden it's not working, not because the ingredient isn't good, but because that specific bottle wasn't, put out to the same standards. So one of the benefits.
Sorry, Mark. I don't want to
Oh, I'm
interrupt you, but
sorry.
I just want to. I want to focus just a second on this because I think this is a very important point. I think the vitamins, the ingredients are great, but when you're going to a pharmacy or you're buying from Amazon, you don't actually know what's in those capsules.
Mm-hmm.
And like I private label my own vitamins for my patients because I know the manufacturer and I control exactly what goes into every capsule. You go get the same vitamin in Walgreens or Rite Aid or whatever it is in your local pharmacy or health food store, you don't know what you're going to get. The other thing is, I see a lot of products that are topical. Like today, I had a conversation with a real expert in NAD. There are all these topical NAD products. Well, it turns out NAD is an enormous molecule
Right.
with a very high molecular weight. So the chance that it's actually getting through the stratum corneum is basically zilch. So
Absolutely.
patients are spending $100, $150 on these topical products that are supposed to rejuvenate their cells, their skin, and they may not be getting anything out of it. So your point of going back to science and having scientific evidence for what we do, I think is very, very important, especially in today's environment of these quote unquote influencers. I mean,
Yes.
I don't want to take advice from an influencer who just has millions of followers because of whatever reason. I want to go to a professional and get real advice. So I think your point is just it's spot on.
Yeah, no, it's so important. And this has to do with not only the issue of medical foods that I'll get to in a second, but as we talked about with hair, with light treatments, there's great data, for instance, with hair that light works. Great data, but it's got to be something that has been scientifically studied, not something necessarily that you get on Amazon right away or you get in your local Walmart, etc. It's got to be where the science is based at the wavelength. Number one is what you want to have the effect, okay? And clinical studies have shown that it works, that this, wavelength, this light cap, etc., is going to work for what you want. So it's all of these aspects, not just about, the issue of what you're putting in your mouth. And I think this is really, really important. Now, in terms of what I was talking about, I look at three ingredients that I feel these days are very critical, not only to the aesthetic and regenerative, but also clinically for our dermatology patient. The first one is curcumin. And curcumin is something that has been used for millennium, especially in Ayurvedic medicine, okay, for its incredible health and healing properties. And there's a medical food. And again, the idea of the medical food is you have this consistency from batch to batch, and you can actually get it by prescription called Rheumate, which is for the curcumin. And the idea is curcumin it's been shown to help psoriasis, rheumatoid arthritis, Crohn's disease.
It's anti-inflammatory.
It's not only anti-inflammatory, it works on the same pathways as the biologics, as the JAKs inhibitors that we hear so much about on TV for these conditions. So clinically, we know that it can help our patients from there. Now, what we also know is aesthetically, curcumin can help pigment. It can help lines and wrinkles. It can do a lot of things, and that probably comes from not only the specific effects on the skin, but also the fact that you're getting this regenerative effect overall in the body. And as you said, inflammation, as we know from regenerative medicine, is probably the last thing we want to keep us healthy. We want the inflammation to go down.
And Mark, just so that our listeners understand, you're talking about the effects on the skin from an oral supplement, not from
absolutely. Well, actually, an oral medical food.
Right. Oral medical food for aesthetic use.
Not only for aesthetic, but for clinical aesthetic and regenerative. So it's interesting. You hear about these regenerative pathways, mTOR. mTOR is a pathway that's not only clinical, it's associated with psoriasis, but it's become one of the biggest pathways that we want to block for regenerative, to help aging, help us prevent
it's anti-aging.
the problems.
It's longevity. It's a longevity molecule.
And serotins. There are pathways in the skin as well that curcumin affects. So again, the idea here is health, is beauty, and is regenerative, is longevity from that perspective. So that's number one. The second is what is known as diazomin. Diazomin is a flavonoid. It comes from orange peel. Very natural. Again, it's called Vasculaira as a medical food. And it's, believe it or not, it's most studied for diabetes. It really has an incredible beneficial effect for diabetes. But clinically, what we find is that for patients who have problems with their vascular system, the veins in their legs, it really does a great job of improving the circulation in the deep veins in the legs. So it helps what we call stasis dermatitis, but also just helps in general swelling and things like that. Now, from an aesthetic viewpoint, it can do multiple things. It can help purpura, what we call Bates purpura or senile purpura. It's been shown to affect that. Clinically, it helps rosacea dramatically, okay? And it also has other anti-cancer and other beneficial effects. So this Vasculaira or diazomin can have, effects across the board from that perspective. And then the third is called genistein. Genistein is very, very interesting because it's something that has been looked at in different ways for millennium, especially in the Asian population, because it comes primarily from plants, soybeans, and then non-soybean plant. And it's called a phytoestrogen. But it's a special phytoestrogen because it's a beta phytoestrogen. And that means you get the positive effects without a lot of the negative effects like increase in breast cancer, increase in cardiovascular disease. And especially in women undergoing menopause, this medication and a medical food called Fostium for genistein can do things like stop hot flashes, improve the bone density, which is what happens. But from the skin, it does some amazing things. It can help lines and wrinkles. It can also help redistribute fat. Because as you know that, when you go through menopause, your BMI goes up, other things happen, but this actually not only prevents it, can look to treat it. So these are the three areas, medical foods, that I'm most excited about, because what we're dealing with here is health, beauty, and well-being. And how, and I think this is all what we want for our patients.
So, Mark, which of these are you taking? Are you taking these medical foods? And
I take roommate. I'm getting a little crickety in my old age. So the anti-inflammatory effects of roommate really are something that is good. Now, it's interesting because genistein around the world is taken for prostate health. I haven't started doing that, but I'm certainly thinking as I get a little older from doing that as well. And again, a lot of different applications when you really dig down into this.
do you, so these are medical foods. Do you take supplements as well? I'm just, I like to
I,
kind of get a little personal, Mark. So,
You can get
um,
personal. It's quite all right, Gary. Yeah,
do you
I
take
take
anything else that
vitamins.
you think is anti-aging?
Yeah, I take vitamins. It's funny that people talk about rapamycin. They talk there are others very specific treatments. From this standpoint. It's interesting. My anti-aging regimen has been twofold. I've been doing meditation for over 50 years. I've written papers on it. I've done studies on this transcendental meditation because the health effects, including on the skin, and I'm pushing 71 pretty soon, I think are very, very significant and very dramatic. So this is something that is part of my anti-aging. The second thing is I tend to eat very, very well. I haven't eaten red meat in about 50 years. I do eat, fish. I have a balanced diet. I tend to eat organic whenever I can from that perspective. I don't really drink much alcohol. I tend to put in the things into my body that I think I want to do. And then I exercise. I get at least 10,000 steps a day. I average around 14,000, either riding my bike or walking. I don't run anymore. I figure, if my knees have lasted this long, I don't want to, push that at this point. So I try to do this from a very holistic standpoint in all aspects of mind, body, and health from that area.
It's amazing. Two things I want to mention. One is there's a lot of controversy on red meat. Some people are now pushing for sort of what some are calling a carnivore diet. I think from a health perspective, a Mediterranean diet or some
Right.
version of it
Yeah.
with, lean meat, chicken, fish, vegetables, fruits, whole grains probably is the best. There's a bigger and bigger push to limit alcohol consumption. I know there's the alcohol consumption in US actually, I just saw this number
It's
somewhere. It's
gone
like the
down.
lowest it's been since Prohibition.
Yeah.
A lot of people are drinking less and less alcohol, which I think is probably great. Um, and one other thing I want to mention is metformin. I know I've been taking metformin for a while for
Okay.
anti-aging, and I think one of the medical foods you mentioned for really for diabetes, really glucose control is just so important.
You're right.
And I think for aging purposes, probably that insulin spike is like the worst thing that could happen. So
And we know
controlling
that
your sugar
processed
intake.
food, no, go ahead.
No, please.
Processed food is really, has been the key change from that perspective. And I think we should all try to avoid as much as possible processed food from there. So, I
Totally
absolutely
agree.
agree with you for the insulin. And, metformin is one way of doing it. Diazepam is another way of looking at this. And people take diazepam for their insulin resistance as well.
Yeah, chromium is another one that's an
Yes.
inexpensive way to control blood glucose levels. So we're going to go from medical foods, diet recommendations to a topic that we're going to actually watch. You brought us a great video.
Yep.
I'm excited for you to kind of tee it up for us. And I'm just going to give people the title. Is that okay with you, Mark?
Sure.
And the title is that botulinum toxin makes you happy. Is that good? How is
That's
that?
great. I love it.
All right,
So
go
I've
ahead.
written a
Tee it
lot
up.
on this, the area we call it emotional anatomy. And it's so, so interesting. Botulinum toxin is the number one aesthetic procedure. You and I do this on a daily basis for our patients. But what we have learned, and there's been study after study on this, that if you treat certain anatomical areas, okay, you get a benefit far beyond beauty. And we've always looked at the benefits for any aesthetic procedure when we're doing a study on how we feel. Okay, there's something called the face Q. There are a lot of different surveys that we do to say, okay, do I feel better about how I look? And certainly if you look better, you're going to be happier with yourself and feel better. But this goes well beyond it. And what we found is that if we treat the glabella complex, those two big muscles, the procerus and the corrugator, you can't frown. And if you can't frown, you can't be as sad. And in fact, Eric Finzi, who's the dermatologist who first identified this actually many years ago, found that it really has become the number one beneficial treatment for things like depression. Because again, treating this area really can not only decrease depression, but increase the area of positivity and happiness. The interesting thing also is there's something that people don't realize. It's called facial mimicry. And what that means is that when you're with somebody and you're frowning, they unconsciously frown too. And when they frown, they don't feel very good. So having them be more positive because we're more positive makes them happier, makes all the people around us happier. And this goes on and on and on. So I always talk in my lectures about world peace by botulinum toxin. If we could get enough people not frowning. Now, what's interesting, though, is that if we treat another anatomical area, the crow's feet, it negates the issue of treating the glabella. And the reason is that we can't fully smile. And there's two types of smiles. One is called the Duchenne smile. And the Duchenne smile is smiling with your eyes and your mouth, which is what most people do. And the second type is called the Pan Am smile or the Botox smile, quote unquote, because you're not doing it with your eyes. And there are people who do this naturally, forgetting about toxin. And what they found is that if they look back in yearbooks, the people who just smile with their mouth and not with their eyes, they get divorced more, okay? And they're not as successful in their lives, which is so interesting. The interesting study.
So the first one is like a real smile, a genuine smile, and the second one maybe is a fake one?
Well, no, you're just not able to smile with your eyes.
So when people fake a smile, I like this topic. A genuine smile versus a fake smile.
Duchenne smile versus not smiling with your eyes. So you can call it a fake smile, smiling with your mouth, but not with your eyes. Yes. You don't
this happens.
feel as happy.
This happens all the time when I do botulinum toxin injections. You ask somebody to smile, and they smile, and you're like, no, like really smile. Let me see you really smile, so I could see the crow's feet.
Right.
So I think all of us have experienced it. Maybe we just haven't, contextualize it as eloquently as you just did, but I think that's spot on there.
Yeah, it's very interesting. And because of this, I have a cadre of patients who come in for botulinum toxin to be happier for them and to be happier for their families. It's very interesting because, the families come in and they said, my mother or my wife or my husband, etc., I'm much happier because they're not scowling at me, okay? And I'm happier and they're happier and the whole family is happier.
So everyone needs a little vitamin B is what you're saying.
Absolutely. So what I'm showing here, which is interesting, is I've modified what I do here a little bit for that, is not only do I treat the glabellar complex, and I'll show you a little bit about how I do this from there, the corrugator and the procerus, but I also inject the lateral superior orbicularis. And the lateral superior orbicularis is the brow depressor laterally. So by doing this, it actually opens up the eye more. You can actually smile more vigorously. You still have the crow's feet here if you're smiling temporarily here, but it actually expands the smile there. In certain patients, I'll also treat the DAO because in that case, the mouth is actually opening up and smiling even more. So what we're doing is we're increasing the patient's ability to be happy. And that's really what I'm showing here. I'm showing this upper face treatment here that I do for happiness for our patients. Not only for our patients, but for their family. We can do that.
Lou, if you can roll the video, please. So Mark, why don't you tell everybody
So what I'm
what you're
talking about
doing.
here is first talking about the issue of the two muscles in the glabella complex, the procerus and the corrugators. Okay. Now, what's interesting is the procerus, it is in different forms in different individuals, and you can determine that by watching them frown from that perspective to see where the muscle is. The corrugator is interesting because there's two parts to the corrugator. There is the belly of the corrugator, which is really in the medial part of the brow, and then a little lateral, just kind of medial to the mid-pupillary line, is the tail of the corrugator. And what is important is that the tail of the corrugator, number one, is much smaller, okay, but it's also a little bit more superficial. So what I'm showing here is, when in this case, I'm injecting this port. So in her, I'm injecting a total of 50 units in the glabella complex, but I'm not putting it evenly. And the reason being that the muscles here, the procerus and the belly of the corrugators, are much bigger. So I put more in that area, and that's what I'm doing here, okay?
So, Mark, just to interrupt you for a second, I'm sorry. How to segment, okay? So, Proceris, you're going deep. Just talk to
Procerus, I'm
people
going
about
deep.
this.
Corrugator belly, I'm going deep,
Deep.
okay? And the corrugator tail, I'm very superficial from there. A little bit up and superficial. And I use half as much as I will in the other muscles because it's a much smaller muscle from that perspective.
Because I think some people are not injecting deep enough in the Proceris and they're not getting the full effect because some of it is going into the dermis, it's not diffusing into the muscle. So I
Exactly.
think that's a little pearl that people can take from this, that you need
And
to
you see,
inject.
I'm injecting on this angle more superficially in the tail right now. And what I'm doing here is I'm injecting the lateral orbicularis, the superior lateral orbicularis, which is, essentially on the lateral aspect of the brows. Okay, well, actually, you can feel the bone underneath, the bony prominence
The
underneath
notch, yep.
the notch, and that will essentially allow the brows. When you're treating these two areas, your brows are lifted. Okay, your brows are. This is especially in men. I almost very very rarely in men treat the frontalis, treat the forehead, because men's brows are for the most
They
part
get
much
heavy.
lower.
Right.
They're heavy. So I tend to raise them by treating the glabella and the lateral orbicularis to lift it.
Lou, pause the video for just 1 second if you can. Mark, I just want to get specifics, okay? So, a typical patient you're injecting with botulinum toxin, we can use brand names. So, you're doing Botox. How many units on average are you putting into each area versus,
Right.
let's say, Dysport?
I will tell
Just
you, it
give us a
varies. It
range for
varies per
people to,
patient.
to
But
kind of
let's
get
say
it.
for Botox, I'll use, let's say 20 or 25 units in the glabella complex. Okay. I will put, just probably 5 or 6 units in the lateral orbicularis. Okay. I can put in the lateral aspects here, okay, 12 units, for instance,
For the
um,
crow's feet.
for the crow's feet areas. And the other thing that I lecture on is I tend to distribute this. I tend to make more injection sites, less
I
per
love it. You're a
injection.
micro injector. I love
I'm a
that.
micro injector. Yes, yes, because you want to distribute it. If you think about the science of botulinum toxin, and I publish this and I speak about this all the time, the idea is not only do we want to know the amount of toxin that we're injecting, meaning what we call the issue of the molecular potency, the amount of 150 kilodalton molecules that are able to bind, but we need to distribute those. What we do is the distribute process, and there are two parts to that. One part is how we reconstitute it. That's part of the distribution. And number two, how we inject it, how many injection sites, okay, and how we distribute it. Because if you concentrate too much, you're wasting it, okay? It's super saturating the area, and you're just wasting it.
It's not
If you're
getting where it needs to go.
not getting where it's to go. And if you're able to distribute it better, and if you know what you're doing, people say, oh, you can get bruising. Sure, you can get bruising, but especially in the crow's feet area, if you go superficial enough, and this is what we do in this area, you're not going to get bruising. So I tend to do at least 4 injection areas plus the lateral orbicularis superior in the crow's feet area, and I distribute it more from that perspective.
I think there's this misunderstanding or a notion that doing Botox is just super easy. That's why all the med spas everywhere, everyone's doing Botox. But, hearing it from you, a real expert, there is a lot to think about from patient to patient because their anatomy is going to differ. They're going to need a
Absolutely.
different toxin. They're going to need a different amount. They're going to need a different distribution of injections. And that's really what separates someone who consistently gets great results from somebody that just gets okay results here and there. So I
And
appreciate the
part of this
specifics.
is educating patients, because as you know, patients come in constantly and say, "Oh, I want to have a natural look. I want to have some movement, and I want it to last 6 months." And it doesn't work like that. In order to get longevity, you're going to get a frozen look. Period. There's no way around that because you have to inject more toxin, and that part of that is education. And part of that, as we talked about at the beginning, is saying to patients, "You're not going to be happy with me. Go somewhere else. Go to the med spa. Let them tell you what they want."
All right. One more question. I think we have maybe a few more minutes.
Sure.
I want you to look in the future. You've had this long career, a lot of exciting things you've done. The next 5 to 10 years, what is it that you're super excited about in the field of aesthetic medicine, cosmetic dermatology, whatever you want to call it?
So again, I'll go back to the issue of health, happiness, and well-being, and beauty fits in there certainly. I think one of the things that we're going back to is naturalness, number one, not being overdone. I think people are finished with being overdone, so to speak, okay? They're done with being overdone. I think that more and more, 2 things are occurring. We have more tools. We have more botulinum toxins. There's actually going to be really interesting because in the next few years, we're going to have hybrid toxins. And we're going to be starting studies on this in the next couple of months. The hybrid toxins marry the heavy chain of the B toxin with the light chain of the A toxin. What that means is more will be able to get in, therefore it'll last longer. You're still going to have the frozen look, but it's going to last longer. I think that, as you said, what's so interesting is what's old is new again. I think people are realizing that, the non-ablative treatments can do some good, but only so much, okay? And I think ultimately people are going back to, you know what, it's worth a week or so or 10 days of downtime because I'm going to see dramatic results from this stuff, from there. Now, and the final thing is, what are we going to do, as you talked about, to maintain our health and beauty in the future? And I think more and more individuals are going to say, how do I maintain what I've gained for the future? And as dermatologists, what we tell them is the number one thing they can do is protect themselves from the sun. This is absolutely key. You have to protect yourself because the sun is the main aspect of photoaging. That's what's causing us to get wrinkles, skin cancers, and the like. And I think what we're going to see from that are more and more innovative sunblocks and sunscreens. We just did a study, which was very interesting, which showed that when you look now versus 20 years ago, there are many, many more squamous cell carcinomas. It's actually now flipped. Used to be 70%
It's more common than
basal cell
basal cell.
carcinomas. Now it's 70% squamous cell. The reason is that we're using sunblocks that are really good at blocking UVB, but not as good at blocking UVA. So people are going out, they're not getting burned, so they're staying out longer. The UVB is blocked, but they're getting much more UVA and they're getting squamous cells and they're getting melanomas. So I think we're going to have an innovation in this area as well.
Mark, I feel like we can talk for another hour, 2, 3 about all these exciting things, but we do have to let you go. And I so appreciate all your expertise and your willingness to come on the podcast and share your knowledge, and your personality, I think, really came through. So I appreciate that as well.
Gary,
so thank you,
we're
Mark.
friends, and it's my pleasure to be here with you, and I love working with you. So
I appreciate it. I feel the same way. So thank you to you, Mark, and thanks to everyone for listening, for watching, and we'll see you next time in Conversations in Aesthetics. Thanks.